go ahead and introduce myself. My name is Michael Fratkin. I'm a palliative care physician, and I'm delighted to be here. So I'm going to tell you a story about burnout and transformation. For the record, we've heard over the last couple of days some pretty clear messages that the healthcare system is broken. And while that's true, that's only part of the story. The actual truth is that our society at large is broken and undergoing a transformation. Our healthcare system is structured and inflicting suffering on the most sick people, inflicting suffering on the most troubled people in our society, and inflicting suffering on the most vulnerable people in our society. People that are completing their lives, people that are moving towards their death, and the people that love them, and people like you and me that wish to serve them. The healthcare system that we have built is inflicting suffering. Now, seriously, burnout in my field is the highest in medicine. I'm a palliative care doctor. 65% of us, 65% of palliative care specialty trained doctors say they're moderately or severely burned out. They say that they'll retire early. They'll quit jobs. They'll work less than full-time because they're under-resourced and the demand for their services is so great. Now, the demand is spectacular. Estimates go from 1 to 2.5%, 3% of the general population as being eligible to receive or likely to benefit from palliative care provided to them based in their home. If you do the math in California conservatively, that's about 400,000 Californians today, tomorrow, a week from Tuesday, next year, that would be eligible to receive and benefit from palliative care. And about 0.4% of those people are actually receiving palliative care services in their home. The costs are incredible. The spending at the end of life is breaking our economy. It's breaking our healthcare system, and it's breaking our society. So we built a system based on fee-for-service that exploits the ill as an input to an economic machine. We built a system that sickens family caregivers and bankrupts more American families than any other single cause. We built a system that depletes the compassion of the social treasure that you and I, as people wanting to do this service, we're depleting the compassion of us. Oh my God. So I should probably introduce myself. My name is Michael Fratkin, Dr. Fratkin. I am a father and a husband and a brother and a son, and I also happen to be a palliative care doctor. Now, my story that lands me here started about 18 months ago when I was so exasperated by the situation I found myself in. I was so burned out that I was getting ready to leave a community where I've cared for more than 1,500 people who've died over these last 8 or 9 years. I've been there for 20 years. My kids were born in my house. My dogs and cats are buried in my front yard. My community, and I was getting ready to leave to go down the road for some corporate job job with better pay, better systems, more resources, and a whole lot less sense of place, sense of purpose, soul for me. So I should tell you, for those that don't know what palliative care is, I'll tell you what I tell my patients. I say that palliative care is a subspecialty of medicine, but I'll pause for you to say it is ridiculous that there is a subspecialty in medicine that focuses on these things. But it is, in America, 2016, a subspecialty in medicine that focuses on two things. One, I'm very good at the treatment of symptoms. So pain, breathlessness, nausea, vomiting, whatever. I've got a pretty good bag of tricks, and I know how to use them. That's the first thing, symptom control. I'm very good at that. The other thing that I'm getting better at every day is that myself and the team in which I am a part, we help people to navigate, to make their way through what are often very complicated medical situations, but what are always very difficult human experiences. The people I take care of do not have a stuffy nose or a sprained ankle or a rash. These people are up against it. So symptom control and navigational support. Now the Center to Advance Palliative Care adds a few nuances to that I think are important. One is they define palliative care as an extra layer of support to the care that you're already receiving from your oncology program, your primary care doctor, your nephrologist, whoever, whatever practice setting. Palliative care is an extra layer of support in addition to those things, right? They also say that palliative care is useful and valuable throughout the course of serious illness, even serious illness that won't take your life. And the focus is on whole patient care, whole system care around the whole family in an effort to improve and elevate the quality of life for people. Now, with ResolutionCare, the company that I founded 18 months ago, we found a way to restore the soul of this sacred work and to scale it. So, first thing I'd like to say, what is soul? What do I mean when I say soul? If I was to apply this question to a room full of poets and dancers and painters and musicians, before they even open their mouths, I'd be able to see that they understood on their face, right? And I see some of that recognition around here. But for the purposes of this discussion and for this audience, I'm going to say that soul is somehow related to the space between what is a patient and a person. That soul is what emerges in the space between a physician and a person, or a nurse, or a social worker, or an administrator, or any operational, dedicated human being doing a job and the person they are, or an institution and the people that created it or operate it. In an earlier session today, a doctor by the name of Michael Caldwell posed a question to the audience that I'm stealing from him. It is, how many people in this room think that you are a body? Identify with being a body. Raise your hands. How many people in the room identify with being a body and a mind? Now, how many of you identify with being a body, a mind, and something else. So that something else that I can't put my finger on, and neither can you, is deeper than ego, is more far-reaching than legacy and CV and all of the things that you can accumulate in a life of action and doing. It's deeper than that. It's what makes it possible to connect with other human beings if you let it. So here's two stories. And don't worry, the second story ends better than the first. In the first, we killed a man. We'll call him Ringo for no particular reason. But Ringo was a poet, a vagabond, a hobo. He would have been a hobo back in the day, riding trains, hopping trains. His life was like on a circuit from Texas to Hawaii to Northern California. Big, long, scraggly beard, skinny little fellow. He was poor as dirt and light as a feather, carrying a backpack on his back is all he had. And in fact, the only thing that really mattered to him had gotten lost with his last backpack, and that was a stack of journals that had his poetry in it. And the friendships and the network that he created were created at poetry slams and events like that. And then he ended up going home with people. They'd let him stay for a couple of weeks, and then he'd hit the road. He was a super sweet guy. So he was referred to me by an oncologist, I think mostly out of just plain befuddlement. He just didn't know what to do with this guy. But what he did know how to do was to treat cancer. And what he was able to do was to consider a guy who really had stage 4 cancer, incurable lung cancer. And he downstaged him for his own psychological purposes so he could feel as if treating him aggressively would be of value to him because he might cure him. So he called him a stage 3B, and none of us understood that. But because he called him a stage 3B, he gave him chemotherapy and radiation therapy over 6 weeks. And 3 days after he completed his course of treatment, he was dead. Now, he was dead in the home of somebody that offered to dedicate themselves to his care. He was dead in a sort of radiant state. And over the course of the last 3 weeks of his life, one of our volunteers essentially downloaded from his mind about 30 pages worth of poetry that I look forward to putting together and publishing on his behalf. So now you kind of get the why of what ResolutionCare is, I hope. I want to tell you who we are and what the hell we're up to. Up above the Redwood Curtain in Humboldt County, 6 hours north of here, up the curly road of 101. I'm a rural doctor, and what we're doing is this. We're building network capacity with soulful professionals for home-based palliative care and a life-affirming work environment for all of those people doing that care. There's a sort of a slogan that's running around the office. We say that we are people that take care of people by doing what makes sense. This is not a Da Vinci robot super tech intervention. This is just people taking care of people and doing what makes sense for people. So we're team-based, interdisciplinary, integrated. We call it transdisciplinary. We've got nurses and social workers and chaplains and community health workers, and our operational team is as much a part of our therapeutic efforts as anybody with a license or a job title that's professional. We're powered by video conferencing, which extends our reach and allows us to do all of our work in the home, whether it's on the ground or whether it's remotely. And we can go anywhere. And we're also powered by value-based payment with our health plan partners. What we're doing next is we're scaling towards the unmet need, towards it, but we're grounded in an organic growth curve. We know what our limitations are, and we have unflinching commitment to the quality and completeness of our intervention. So ResolutionCare is legally a benefit company. Do you know what a benefit company is? Next year, hopefully, I'll come and talk about benefit companies and B Corps, but we're in the process of becoming a certified B Corp. We're capitalized by the people we live with. We're capitalized by our community, individuals, community economic development agencies, and anyone really who's been following our story and wants to be a part of what's going on, see me afterwards. We're partnered with visionary health plans, both public and private, that make it possible. We're using business as a force for good. And we're bringing the concept to healthcare, this concept of benefit corporation, of corporation or an organization or business that's dedicated to returning on for all the stakeholders, not just the shareholders. And we're bringing that concept to healthcare on the strength of our success. So please be in touch, reach out. These are my contacts. I'd love to talk to people, and thank you so very, very much. And I definitely have time for a few questions, don't I? Do I? Don't I? Yeah, I do. Are there any questions? Yeah, I love talking about it. Yeah, so there's two concepts. One is a benefit company or corporation, a legal structuring. You register your business in that fashion. You're still a for-profit entity, but you bake into the underlying genetics of the organization good financial performance, but social impact, workforce well-being, environmental and economic impact. All those things are baked into the sort of fiduciary base that a board of directors or a management committee has to attend to. That's a legal structure. I think there's 13 states that allow it. Now, there's an organization, a nonprofit called B-Lab. And wherever you are, you can become certified by B-Lab. And they have a very rigorous set of assessment tool and an annual process. It's like 60 pages worth of input of information. And if you qualify by meeting the minimum criteria of 80 points, you can join organizations like Patagonia, like Ben & Jerry's, like New Belgian Brewery, Prana, Method. These are all companies that are iconic because we know that they mean more than whatever comes out of the bottle or whatever you put on your shoulders. It's more than the product. It's a supply chain. It's their whole ethos, right? And so in Georgia or Soviet Georgia, you can, any Georgia you pick, you can be a certified B Corp. So go to B-Lab and begin exploring that process. What you'll find is what we found is that in healthcare, there are less than 20 organizations that are certified B-Lab, B Corps, and all of them are tea and acupuncture. There's one employee-owned home health or caregiver agency back in Pennsylvania that's very cool, and they've been around for a while. But in the world of healthcare, right, we're supposedly in business to be of service to people who need us. There's not very much activity in this area. You know. Good?